And I'm going to say something as long as Jen's coming up. This is the first time Jen's been a head vet, so it's really been great. I've watched her working with other vets and things, and so this is really good. She's here all 3 days with her baby and her husband, who's been shoeing the horses and stuff. All this.
Thank you. So, well, I had a lot of fun today, and I hope everybody did. There was a lot of good people out there, and people taking good care of their horses and having a good ride. And unfortunately, we had a few horses that didn't fare very well in the heat. Not that it was all that hot, but, you know, everybody has a bad day. And we had, you know, but everybody seems to be doing good, and that's what's important, and that people have fun. So tomorrow, pulse will again be 60 and 64 criteria at the finish. I would like tack off again at the hour hold and at the finish. I know it seems a little ridiculous since they're only 4 miles apart, but it really does help us to assess the horse better, to see how the saddle's fitting. You know, and I think since this is an education ride, you know, it's best to get the maximum amount of information. You know, I mean, we had a horse today that was sensitive in the girth area, and the rider said that she'd had the same girth and the same saddle, and, you know, everything was the same, and he'd never been sensitive before, and then today he was. So, you know, she's going to try, you know, different girth and see how that goes. So, you know, this is all useful information because, you know, relatively these are short loops. You know, so, you know, when a horse gets sore after 30 miles with a girth, he's going to be really unhappy after 50 or 100 miles. So, you know, definitely it's good information. And when the tack is on, it's harder for us to assess their back and their girth area and all that. So, I know it's a pain, but we appreciate the tack being off. And then, yeah, what Terry was saying, you know, please look at us, you know, because we're trying to assess your horse's soundness as they're going out and back. And so if you're going sideways, it's much harder to see the symmetry or asymmetry in how your horse is traveling. So if you glance up and you see us going like this, and we're scooting trying to get in front of you, then you're probably not coming right at us. So you need to readjust course. You know, as far as, yeah, what Terry said, you know, probably looking in the mouth is the biggest problem that I saw. About half the horses tend to give me a hard time about it, and I don't know about the other vets, but it seems like, you know, about every other horse I look at, you know, I have to wait a few minutes, try to, you know, pet their muzzle, you know, just to get them to let me look. And I think, you know, with endurance horses, you know, they're probably fearful that I'm going to electrolyte them or deworm them maybe. But, you know, if that's the only time that you're touching your horse's mouth is to shove a syringe in it, then you need to spend some more time touching their mouth, because, you know, endurance horses should be really, really good about that, because multiple times in a ride we look in their mouths. And so, you know, they should accept that pretty readily. It's, you know, one of the biggest things that will frustrate a vet, you know, because typically when you're trying to look in their mouth and they're not letting you, what ends up happening is we end up getting clocked on the head with their chin as they're swinging their head over the top of us, you know. And, you know, you know, we try to be patient, but, you know, when it hurts, you get to get a little ticked off at the horse, you know. So it's something that, you know, really goes a long way for us, you know, making our jobs easier. It'll get you in and out faster. And then the other important thing about that is, if your horse is stressed about having its mouth handled, its heart rate's going to go up. So, you know, you're going to help yourself too if you can get your horse to be calm and relaxed about having its mouth looked in. You know, if the horse is fighting and struggling and throwing its head all over the place, your heart rate's going to go up, and then that's, you know, possibly going to cause you to have to return to us for a recheck or something like that. So I would, you know, encourage everybody to spend some time just, you know, you don't have to just, you know, go and attack your horse and start flipping its lip up. You know, just spend some time rubbing their mouth where they're comfortable with it, you know, and just get them relaxed about it, you know. But you know, overall, I didn't get kicked out today, and nobody ran over the top of me, so that's always great, and I want to thank everybody for that. So, yeah, and we'll have another good day tomorrow. So, thank you. So I'm Dr. Jennifer Mather, and this is the 2011 Tevis Education Ride, and I'm functioning as head vet this year for the Education Ride. We're here at the White Oak Vet Check on Saturday. It's the first vet check. It's a 20-mile vet check, and there's an hour-long hold here. And basically, what we do when the horses come in is that we are assessing their vital signs to ensure that they are not becoming overly tired and overly strained by the exercise that they're being asked to do. We're here to protect the horses and also to assist the owners in taking care of their horses. Most people are really very, they're astute, they're tuned into their horses, they care about their horses, and so they'll bring problems to us and say, he's not feeling right or he took a bad step, and, we help them out, but we're also there to catch things that the owners don't notice. So we're looking for lameness, a horse that, had an unlucky encounter with a rock, stepped on a rock, and now has a sore foot or a sore leg. So we want to catch those horses so that problems don't become worse as they go down the trail. And then also we're looking for horses that are becoming overtired for whatever reason. They're not coping with the heat or the terrain or the level of exercise that they're being asked to do. Most people that bring horses in for a ride have a good idea of what it takes to get them fit. But even a fit horse can have a bad day. Just like people, sometimes you wake up and you just don't feel right. And so we're taking the heart rate, we're listening to the gut sounds, we're checking the mucous membranes, the gums, making sure they're not too pale or too dry, assessing the hydration status of the horse and just really trying to evaluate where they are metabolically. Heart rate is really important. We set a pulse criteria at the vet checks. Horses have to meet pulse criteria. Most often the pulse criteria is 60 beats per minute. So horse must decrease their heart rate to 60 beats per minute in order to be allowed to continue. A horse that is maintaining an elevated heart rate above 60 beats per minute, that's an early warning sign that they're becoming overly tired, overly stressed by the amount of exercise. They can't talk to us and they can't tell us, hey, I don't feel good today, I'm getting too tired, I think I need to rest, I need to stop. And these animals they'll keep going for you, and so it's our job to identify the animals that, are starting to have a problem, and, to keep them safe. We assess their heart rate. We do what's called a CRI, it's a cardiac recovery index. So once the horse has met that 60 pulse criteria, we trot them out a certain distance and then take the heart rate again to make sure that it hasn't elevated too greatly above where they started from. A horse that perhaps meets criteria but then elevates their heart rate 8 or 10 beats a minute over what the original heart rate was, that's a sign that they're becoming too tired. So we evaluate that. Horses that are getting overly dehydrated will have decreased intestinal motility, so we listen to their abdomen to make sure they have good gut sounds. We look at their gums, make sure their gums are moist and pink, signs that they're doing a good job of perfusing their body and that they have adequate hydration for saliva secretions and things. Very dry gums can be a sign of dehydration. We also pinch the skin tent to make sure that they're well hydrated, and we also assess how the tack is fitting. At this vet check in particular, it's an hour hold, so we've asked for the tack to be off so we can feel the horse's back and check their chest and their girth area and make sure that none of their tack, their breast collar, and their cinch isn't rubbing raw spots in them. We check their legs for wounds and that sort of thing. And just generally we're here to make sure that the horses stay well taken care of and healthy and that they are fit to continue on the ride.